Hey everybody, welcome to another Mancoll Minute. Hope it's been a great week for you as well. So, been a very busy week here. Seen a bunch of patients who coming in specifically for body contouring, specifically for liposuction. And I love that conversation. Lipo is one of my favorite things to do. It's an incredibly powerful technique of shaping and sculpting. It's not weight loss. I've talked about that plenty of times before. Although keep in mind my upper limit of removed fat's about 5 liters, and that's about 10 pounds if you really kind of, put that on the scale. But with that said, I'm also hearing a couple of misunderstandings or misconceptions or myths, if you want to make it seem a little more mysterious, about liposuction. So let me clear the air on that. The first one was that liposuction is not a weight loss program. It's the hard work you have to do to lose weight in the gym a lot quicker, but it is not a substitute for not keeping it going in the gym. So that's first and foremost, you have to do that. Then people will say to me, well, if I have liposuction and then I gain weight, it's just going to go somewhere else. And the answer to that is, well, yeah, kind of obviously it will. Because if the fat's removed from one spot and you're putting on another, let's say 10 pounds to make the math easy, it's got to go somewhere. It's going to go where the fat is remaining. And theoretically, it will kind of follow the genetic predisposition your body has of where you put fat. So yes, if you remove a ton from your waist, we do Lipo 360, get that waist, those flanks, those hips, upper, lower back, really shape that waist. Then you put 10 pounds on, you might in fact find your arms, your breasts, your legs, even your butt gets a little better. Now that might be a positive for you, or it may not. So yes, that absolutely is the case. The other thing people were saying, well, if I have lipo, then my cellulite will get better. And the nice thing is I can kind of show them some really good before and after, specifically looking at cellulite. And what I would tell you is it most likely will be improved, but it will not go away. Remember, cellulite is that dermal attachment, these fibers that go from your skin down to your fascia. They kind of pucker like buttons on a mattress. Now I have cellulase, which can be very effective for treating cellulite. I have Renuvion or J-plasma that I think also can be effective in a similar way of tightening those things. But for most of the patients I see, we grade cellulite on a scale of 1 to 3. Most people are coming in as sort of this grade 1 cellulite. It's just kind of this little bit of irregularity. It's not these major dense or hailstorm type of look on their skin. But that light amount of cellulite, that's not really going to correct significantly no matter what you do. It's just not bad enough to see a major improvement, and that's a disappointment for a lot of people. So I just try and be very upfront and say, listen, it's probably going to be improved, but it's not going to go away. And I can try and clip those fibers, add a little fat to them. I mean, there's little tricks we have to try and certainly improve on that. But if you're not starting with really perfectly smooth skin, you're not going to end up with perfectly smooth skin. But so I want to be realistic for you with what it can do. Can do great contouring on the big levels, but some of that stuff really might need some other type of procedures to specifically focus on them to make them better, but I tell people it's rarely 100%. Not a reason not to consider it or do it, because it's still a marked improvement in so many other ways, but there are limits to what it can do. And then lastly, people will come in with a lot of loose skin and go, well, lipo is clearly going to make my skin better. And then again, my answer is lipo is really not great for tightening skin. I tell people the numbers thrown out are about a 5% skin tightening, for whatever that means. But I do again have Renuvion J-plasma, which is a energy I can go in after lipo to sort of stimulate and tighten those connections from the dermis to the fascia, that fibroseptal network, which can kind of maximize how I can tighten skin short of doing what I call an excisional operation, which is literally where I cut the skin away. And I like to use the numbers, and these are a little bit sort of anecdotal, vague, but just sort of what I'm taking from what the literature has for me to use as the science behind it. And if my doing a tummy tuck, for example, is 100% improvement in the tightness of your skin, the J-plasma will get you about 30% of the way there, give or take a couple of percentages. So that can be pretty significant for a lot of people, but it's never going to be as good as when I really can control it by cutting it away. But without having that extra scar, that extra recovery time, it's a great add-on for when people are doing lipo, particularly around the abdomen, the bra rolls, inner thighs, those areas where skin tend to be loose, or people tend to want it improved. It's also great, by the way, for the neck and the arms. So those are some basic kind of, I guess, conceptions or misconceptions people have about lipo. Hopefully that clarified it for you. Love to talk to you more in depth about what your needs are and your questions. This is a great time of year, doing a lot of lipo as folks have sort of gotten out of summer, maybe sort of kind of hung around a little too much, drank a little too much beer on the beach or by the pool, maybe a little more fat than they want. And although they're back in the gym, just not seeing those changes, you know, this contouring operation is a great way to go into the holidays. So give me a call. Look forward to talking to you next week.